The majority of gynecologic cancers, I would say the lion's share of them occur in women past the reproductive years. But there are actually a large portion of the cancers we see that occur in younger women, and we're actually seeing more and more of it. And a concern amongst these young women is their future ability to have children, their future fertility. And fortunately, in many cases, we do have the ability to preserve their fertility. For instance, a young teenage girl with an ovarian mass, the ovarian mass turns out to be malignant. In many cases, we don't have to do a hysterectomy. We can save the opposite ovary, save the fallopian tube on the opposite side in many cases, and allow that woman to still have an optimal chance for having her cancer cured, but also still have a chance at having children. Cervical cancer is another cancer that affects young women. And we have many new options to treat cervical cancer surgically, where we preserve the uterus, preserve the tubes and ovaries, and preserve the ability of the woman to maintain her fertility. Additionally, we try to work with the infertility experts in many cases to try to allow a woman to maintain her ovarian function, or at least in some cases, in rare cases, we might be able to preserve some eggs prior to undergoing cancer treatment, so that in the very near future, the reproductive endocrinologist here will be able to, in the form of cryopreservation, preserve some eggs for future fertility purposes.